knock. Can I come in?
Come in.
Coming in, performing hand hygiene, and closing the door for privacy. Hello, my name is Charissa. I will be your nurse today. We're going to do a quick head to chest assessment on you. Should take about 20-25 minutes. Is that okay?
Okay.
Can you tell me your name and date of birth?
Maria Asuncion Maranan, August 15, 1954.
Looking ear band, it matches. And first question before we get started, actually two. Do you have any allergies to latex, medication, drugs, or food?
No.
How about any pain?
No.
On a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, you would say 0?
0.
Perfect. Okay, I'm going to get started on your physical appearance. You look consistent with your chronological age, no signs of acute distress, and no visible devices such as canes, walkers, or anything like that I see. I am going to go ahead and ask you a few more questions here. Can you tell me who you are again?
Maria Asuncion Maranan.
Okay, do you know where you are?
Yes, in the clinic.
Okay, and what's the time of day or the day of the week?
Today is Tuesday.
Okay, and do you know why you're here?
For checkup.
All right, so patient is alert and oriented ×4, which is great. I did want to take a look at your behavior. So you are maintaining eye contact, which is your facial expression. Your mood is calm, cooperative, and your affect is benign. Speech is clear and articulate. You looked appropriately dressed for the weather and situation and well groomed. Take a look at your vital signs next. I'm going to take your temperature underneath the tongue. It is 98.6 orally. Your pulse, when I check for a full 30 seconds ×2, is 68 beats per minute. Her respiratory is, in a minute, is 16 and unlabored and regular. Blood pressure is 120/80, and when I put the pulse ox in the patient, it is 99% on room air. Next, I'm going to take a look at the patient's skin. The color is consistent with the genetic background. I do see pink undertones. I don't see any lesions, wounds, incisions, or any piercings except for her ears. I don't see any tattoos as well. I'm going to go ahead and palpate the skin for temperature, both dorsal part of my hand here. All right, it is warm and dry and smooth. I'm going to pinch underneath the clavicle to check for hydration. Is that okay?
Okay.
All right, I'm going to go ahead and pinch here. All right, it's nice and elastic and no tenting noted. The next thing I'm going to do is going to take a look at your nails here. So it is round. The color is actually pink. It is well groomed and it is nicely shaped, oval shape, and I don't see any clubbing noted. I'm going to pinch a few fingers and toes to check for cap refill. A few seconds. It does. The cap refill on the fingers less than 3 seconds, and then the toes is less than 3 seconds. Perfect. Next, I'm going to take a look at the patient's head and her face. So her facial features are symmetric bilaterally. Can you smile, frown, puff out your cheeks, and raise your eyebrows? It is symmetric bilaterally. And taking a look also at the patient's head, I'm going to take a look, inspect it first and then palpate after. I'm going to take a look. There's no lesions or infestations. And is it okay if I palpate your head?
Okay.
Okay. No lesions or infestations as well. I'm going to take a look at the patient's neck next. Can you look up for me? Okay. Trachea is midline. Perfect. And then I'm going to take a look at the patient's eyes. I'm going to go grab my pen right here. Looking at the external ocular structure first. I don't see any discharge or redness or any lesions. Next, I'm going to inspect the patient's eyebrows, eyelashes, eyelids. It is nice and symmetrical bilaterally. I'm going to have you go ahead and pull your, one at a time, is okay. There you go. Yep, one more. All right, so her conjunctiva is pink and clear, and her sclera is china white. I'm going to take a look at your eyes. Can you just look straight ahead at the camera for me? Okay. If the pen light works. All right. Perfect. One more. Good. And then I'm going to have you take a look at the tip as I bring it closer to you. Good. One more time. Patient's eyes are Perla. And the size, which I forgot to mention, it looks like a 3. 3 is the size. Okay. So the next thing I'm going to do is I'm going to go ahead and take a look at the patient's ears for the external structure of the ears. So I'm going to take a look if there's any lesions and taking a look at the piercings. Can you? Okay, see. All right. And then I'm taking a look at the ears. I don't see any lesions. And she does have 2 ear piercings. Okay. Then I'm going to go ahead and check externally, which I just did, and any discharge, any swelling or redness that I did not note. The next thing I'm going to do is do the whisper test. I'm going to stand behind you. You're going to cover one ear and you're going to say the word after I whisper it.
Dog.
Okay, have you covered the other side?
Cat.
All right, perfect. Cranial nerve 8, which is intact, which is the whisper voice test. The next thing I'm going to do is inspect the patient's nose for any lesions. I'm taking a look at the external structure. I don't see any lesions. It is nice and symmetrical and midline. I'm going to take a look up at the nose to note any deformities, asymmetry, or inflammation. Can you tilt head up? So no deformities, no asymmetry or inflammation. I'm assessing for drainage. I don't see any. And then I'm going to have you check for patency, nares, to check your nares for patency. I'm going to have you cover one nostril, breathe in and out, and the other one. All right, so it looks good. No, both nares are patent bilaterally. Okay, next thing I'm going to do is check the mouth and throat. So I'm taking a look at your lips. It's nice and pink and moist. I'm going to have you say ah for me.
Ah.
Stick your tongue out. Ah. Good. All right, you can close it. So looking at the patient's tongue and gums is pink and moist. Her buccal mucosa is pink and moist. Her soft palate is pink and moist, but her hard palate is white with irregular transverse rugae. And then I'm going to take a look at the patient's teeth. It's nice and straight and white and well defined. And when I did ask her to say ah, her pharynx has no redness or any drainage or anything like that. All right, the next thing I'm going to do is take a look at the respiratory system, which I'm going to grab my stethoscope. Oopsie, it's right in front of me. I am going to inspect the patient to see if there's any accessory muscle use. Doesn't look like she's using any accessory muscles. Then I'm going to go ahead and listen to her lung sounds in about 6 different positions. Can you put the dog down? All right, I'm gonna have you breathe in and out as I move the stethoscope. All right, so we'll start with the right upper, left upper, still left upper, right middle, right lower, and then the left lower. Good. Lung sounds are clear bilaterally, no adventitious lung sounds. And I'm going to have you stand up here. Look at the patient's posterior side. I don't note any scoliosis, kyphosis, or lordosis. And her AP to transverse looks like a 1 to 2. So that is nice and normal. I'm going to do the same thing. I'm going to go ahead and auscultate, starting at the left upper here. Breathe in and out for me as I move the stethoscope. Perfect. Lung sounds are clear bilaterally. No adventitious lung sounds. Go ahead and have a seat. Okay, Next thing I'm going to do is your cardiovascular. So the first thing I'm going to do is I'm going to palpate one at a time your carotid arteries with 2 fingers. Carotid arteries are 2+ and regular. Then I'm going to auscultate the carotid arteries for bruit, so I'm going to use the bell part of the stethoscope now. Okay, I'm going to have you hold your breath for me. Go ahead and hold your breath. Good. Breathe. Okay, hold your breath. Good. No bruit noted. As I was doing that, I'm taking a look to see if she has any jugular vein distension, left and right. I don't see any JVDs on inspection. And then I'm going to take a listen to your 5 different areas of your heart, starting with the diaphragm, then again with the bell. Okay. The second intercostal space, right here. On the right side is your aortic. The second intercostal space on the left is your pulmonic. Third intercostal space on the left is your Erb's point. Fourth intercostal space on the left is your tricuspid. And fifth intercostal space, mid-clavicular line, is your mitral. It's also your apical pulse that you can count a full minute. Good. S1, S2 is heard throughout, and no extra heartbeats or murmurs. Then I'm going to do the same thing with the bell. Okay, second intercostal space on the right, aortic. Second intercostal space on the left is pulmonic. Third intercostal space on the left is Erb's point. Fourth intercostal space on the left is your tricuspid. And then fifth intercostal space on the left here is midclavicular line is your mitral. Okay, S1, S2 heard throughout, and no extra heartbeats or murmurs. Okay, the last thing I'm going to do is go ahead and go like this for me. I'm going to take your radial pulse here and here. I can take them at the same time. Okay, it does look like it is 68 beats per minute, regular 2+. All right, that concludes my assessment today. Just wanted to rate your pain again on a 0 to 10 scale, with 0 being no pain, 10 being the most pain. What would you rate your pain?
0.
All right, I'm going to put the bed in the lowest position, one side rail up, bed locked. I am going to give you the call button here. If you need anything, please press this button right here. And do you need anything right now?
No.
All right, I will let the doctor know the findings of your assessment, and thank you for letting me do a head to chest assessment on you.
Okay.
All right, I am gonna go ahead and perform hand hygiene as I close my door on my way out, okay? Closing the door, okay?
Okay.
All right, thank you.
You're welcome.